Hey guys, it is Julie Miller, acupuncture physician with Health Point Jacksonville, coming to you live once again. Today we're going to continue our talks as well as continued awareness for National Infertility Awareness Week. So today I wanted to chat with you a little bit about a syndrome that is very common in causing difficulties with conceiving. It's a very common thing that I treat in the clinic with some of my couples and try to help to regulate hormones, and that is polycystic ovarian syndrome. So it's very common. It goes undetected for many years, and it's difficult to get a complete diagnosis simply because by the time a woman starts to menstruate, sorry, I got distracted, but by the time women start to menstruate or girls start to menstruate, sometimes there can be some irregularities with menstruation. And in order to keep that consistent through school, per se, maybe some parents might take their daughters to go and get on birth control pills just to keep that nice and consistent and maybe stop inconsistencies and difficulties, so that person might be on birth control pills for a very long time until, say, they want to stop to maybe try and start having a family. And that's where some inconsistencies can be further figured out and uncovered. So polycystic awareness syndrome isn't just one thing. So it's a group of symptoms. And there's also 4 different types of polycystic awareness syndrome, which is why it also complicates things in trying to get a diagnosis. So I'm going to quickly go through the 4 different types, and then we'll chat a little bit about what maybe you can do at home, as well as how we can help you in the clinic to help regulate menstruation, which helps to, again, boost up that fertility factor. So, which is what this week is all about, to raise awareness about fertility struggles. And this is a very common reason that women struggle with fertility. So, the first type is the insulin resistant, and that is the most common type, and that is where the patient's body, the woman's body, has difficulty regulating sugar. So insulin becomes difficult to moderate. So, and that can be caused by whether or not that's diet driven, whether or not that is genetic. Maybe there's a history of diabetes in the family, so there's difficulties with regulating sugars, but that is by far the most common type. So the second type is going to be the pill-induced PCOS, and that's what I was just mentioning just a moment ago, where women can go and be put on birth control pills for many reasons, and that can start at a very young age. And it can and women can stay on the pill for very long periods of time. I've seen women that have been put on the pill for 10, 20 years. So, and they're not sure, have no idea that they can't ovulate on their own. Key factor to PCOS is not being able to ovulate on your own, but they have no idea that they're not able to do that on their own because they have been on this medication for such a long period of time. Now, granted, the general population, if that's the correct wording, but a lot of women, once they're taken off of the pill, then regain the ability to have a regular cycle within a few months, maybe a month, maybe 3 months, to help. Then their body kind of gets back on that regular cycle of being able to menstruate on their own, and that is because they can ovulate on their own. But women will come off the pill, and it can take many months, 6, 12 months, 18 months before their menstruation comes back. And that's when they're going to perhaps go to seek out why this is happening and go to their physician, their gynecologist, and maybe go through some further testing to see what's happening. The third type is inflammatory PCOS, and that is caused by a chronic immune activation, and that can be stress-induced. That can be environmental stress-induced, so toxins, constant hormone inundation, and that can be found in our food, and that can be found in plastics and makeup and so many things that we use and eat and put on our bodies on a regular basis have these exogenous hormones. So, and that can affect our menstruation. So that is another cause. And then the last one is a hidden cause, PCOS. And I'm going to sit up straighter here. There we go. But it is maybe not falling into the first three most classic types of PCOS, and that can be there's a certain body type that can be very consistent with somebody who has polycystic ovarian syndrome, but this other hidden cause PCOS, you perhaps don't have the typical symptoms. And that can be an easy switch though. So we can find out what might be causing that in ovulatory time and whether or not that's just like maybe one food group, say soy or sweeteners or even dairy. Dairy is a big hitter as well with PCOS. So if you have irregular menstruation, have no idea if you ovulate and no idea what the symptoms are, we can help you with that. So you can certainly feel free to schedule a consultation. I'll put information below how you can contact us and maybe how we can be of help to you and helping you find out more information about regulating your menstruation, which is the #1 foundation to boosting your fertility factor. And we can go over that with you in depth and put you on the fertility program, whether or not you're trying to conceive naturally or whether or not you are seeking assistance with a reproductive endocrinologist going through IVF or IUI. But we specialize in this and have been for many years and have many, many, many satisfied patients with healthy babies. So we'd love to help you. So I'm going to end now and just close by saying again, we're doing these consistent talks this week to remind everyone that this is the National Infertility Awareness Week. It is from April 21st through the 27th, and I'm going to try and be more cognizant and more present in trying to answer any questions that you might have in relation to some fertility struggles that you may be going through or maybe somebody that you know may be going through, because statistically, I'll repeat this, 1 in 8 couples will experience fertility difficulties. So please send them our way. We'd love to help. We'd love to help you. So be well. See you soon.